Today we're in Brixton asking the members of the public about their healthcare experiences. So I just wanted to find out, what has your experience navigating the healthcare system been like?
I think up until very recently, I think everybody just took it for granted that what their doctors and healthcare professionals said was the best thing for them. You know, I don't think anybody ever really thought about independently researching and thinking of themselves as an individual rather than just a massive data. So after a couple of years of the COVID and the pandemic, I started independently researching for myself and found that doctors kind of say what they're told to say, or what they think is right, which isn't necessarily right for the individual. So it's made me less trusting now and taken back some of that responsibility for my own health.
And you mentioned it's made you less trusting. So where do you go to and what do you trust at the moment?
I think it's about going back to basics. Like, what I put in my body is going to have a massive effect on the outcome. So I think diet's really important. I think, people's sort of stress levels. So that might be to do with their home environment or their work environment. So I think that if I'm asking someone about their health, I want to find out how their general lifestyle is, as well as where they are emotionally. And I think we've just sort of disconnected everything. So the health service tends to just focus on the physical, and even when they do that, they don't start with the absolute basic, which is, what are you eating, how much are you drinking, how many hours are you sleeping, and then to be a bit more personal, how happy are you, or what would you like to change, and so on and so on. So I think it's about being a bit more human and dealing with people as individuals. And that was there at some point. I remember watching that television programme about GPs, and a lot of people just were going there because they just wanted someone to talk to and offload. But since the pandemic, that's all changed now. They're more or less being told to, treat yourself at home. Even if you're having like heart pains and things, it's just gone completely the other extreme.